Hello everyone, I'm Anas Al-Awaidi, and the topic for this session or the topic for this lecture is Neurology and Ophthalmology Scribe Certification Exam. It is within Chapter 29 of Review of Neurology and Ophthalmology Scribing within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. The Neurology and Ophthalmology Scribe Certification Exam serves as a critical milestone for medical scribes aspiring to specialize in these two intricate and demanding fields of medicine. This certification underscores the role of scribes in ensuring seamless documentation, which is crucial in supporting providers delivering complex, patient centered care. Successfully passing this exam certifies not only knowledge but also the ability to meet the high standards required for documenting in neurological and ophthalmic specialties. Now, neurological and ophthalmic care often involves managing multifaceted conditions that require precision, attention to detail, and an understanding of diverse symptoms and diagnostic procedures. In neurology, for instance, entails documentation of a vast range of disorders such as stroke, epilepsy, multiple sclerosis, MS for short, and Parkinson's disease. Each condition demands detailed and specific recording of symptoms like motor weakness, paresthesia, or seizures. Scribes must also ensure the accurate transcription of neurological tests such as CT scans, MRIs, and lumbar puncture findings. These recordings directly influence diagnosis and treatment plans, highlighting their critical role in patient outcomes. Similarly, ophthalmology presents its own set of complex challenges. Scribes must adeptly handle the precise documentation of vision assessment metrics, intraocular pressure measurements, retinal imaging results, and surgical procedures like cataract removal or laser treatments for diabetic retinopathy. These details aid in monitoring progressive conditions such as glaucoma or macular degeneration. Furthermore, the ability to document patient symptoms such as sudden vision loss, floaters, or pain is key to identifying um, potentially urgent scenarios like retinal detachment that require immediate attention. The dual focus of the Neurology and Ophthalmology Scribe Certification exam reflects the evolving nature of healthcare, where multidisciplinary collaboration is essential. Many conditions, such as optic neuritis, demonstrate the overlap between neurology and ophthalmology, emphasizing the need for scribes to maintain meticulous and well integrated patient records. These records not only guide diagnosis and treatment but also facilitate communication among specialists, ensuring the best outcomes for patients. Mastering these rigorous documentation standards requires a combination of theoretical knowledge, practical application, and the ability to adapt to real world clinical scenarios. Scribes must be familiar with medical terminology, diagnostic tools, and treatment protocols in both fields. They must also understand how to manage patient records in compliance with healthcare regulations such as HIPAA, as it is a regulation for protecting personal data in USA, which is similar to GDPR, maybe in European Union and EU, while supporting efficient workflow and fast paced environments. These challenges make preparation for the certification exam both demanding and rewarding, as success reflects a deep understanding of the specialties. By earning this certification, scribes solidify their role as an indispensable contributors to healthcare teams. They gain recognition for their expertise in navigating the complexities of neurology and ophthalmology while also enhancing their career prospects. Whether working with neurologists to document post stroke recovery plans or assisting ophthalmologists during advanced imaging procedures, certified scribes are equipped to make a tangible impact on both patient care and clinic efficiency. Key points here, we'll start with the comprehensive symptom documentation. Neurological symptoms, we have overview, as neurological conditions often present complex and subjective symptoms requiring precise documentation. These symptoms are critical in determining the underlying condition and planning treatment. Examples: headaches, timing, aura, location, intensity, and associated symptoms like nausea or photophobia. Example: patient reports throbbing headache starting 6 hours ago, localized to the left temple with sensitivity to light. Importance here: this documentation helps distinguish migraines from tension headaches or serious conditions like subarachnoid hemorrhage, SAH for short, SAH. Now, here a diagram summarizing the neurological symptom documentation. Seizures: type, tonic-clonic, focal, duration, triggers, aura, and postictal state. Now, confusion, weakness. Example here: generalized tonic-clonic seizures lasting 5 minutes, patient drowsy and confused post-seizure. Importance here: essential for diagnosing epilepsy or differentiating seizures from other neurological events. Motor weakness and paresthesia, record muscle group involvement, symmetry, progression, and association with pain or trauma. Example: progressive right arm weakness over 2 weeks associated with occasional tingling and no trauma. Importance: critical in evaluating conditions like stroke, multiple sclerosis, MS, or neuropathy. And here is a diagram summarizing the seizure and weakness evaluation. Ophthalmic symptoms, on the other hand, focus here. Ophthalmic symptoms often overlap and require keen attention to detail to differentiate between conditions. Example: blurred vision, onset affected eye or eyes, progression, and associated factors like pain or discharge. Example: blurred vision, OS since waking up, no pain, worsened in bright light. Importance: helps identify common causes like cataracts versus emergency conditions like retinal detachment. Eye pain and redness, severity, timing, triggers, for example, foreign body and discharge type, water or purulent. Now, and or purulent. The example: severe eye pain, OD, accompanied by redness or redness and mild photophobia. Importance here: enables accurate diagnosis of conditions such as angle closure, glaucoma, or uveitis. Vision loss, sudden or progressive changes, pain association, and whether central or peripheral vision is affected. Example: sudden central vision loss, OD, painless, occurring over the past 2 hours. Importance here: critical for identifying retinal vascular occlusions or optic nerve conditions. And here is a diagram summarizing the ophthalmic symptoms analysis. Diagnostic standards here: neurological diagnostics. Scribes need to document diagnostic tests and their clinical relevance as well as interpretive findings stated by the provider. Examples of key diagnostics: we have CT MRI findings, lesion locations, infarct size, or evidence of hemorrhage or bleeding. Example: MRI shows hyperintense lesion in left periventricular region consistent with MS, multiple sclerosis. Electroencephalography, EEG patterns of abnormal electrical activity. Example: EEG shows generalized spike and wave discharges indicating epilepsy. Lumbar puncture results, opening pressure or cerebrospinal fluid, CSF analysis. Example: elevated CSF protein and pleocytosis suggest Guillain-Barré syndrome. Ophthalmic diagnostics: accurate transcription of ophthalmic tests is crucial for tracking progressive conditions. Examples of essential tests: optical coherence tomography, OCT, retinal thickness, fluid presence or detachment. Example: macular OCT reveals 480 micron retina thickness suggestive of macular edema. Visual acuity, VA, corrected or uncorrected Snellen chart values. Example: um, VA measured at 20/30 OD with correction. Fundoscopy and fluorescence, angiography, retinal and vascular abnormalities. Example: flame-shaped retinal hemorrhages, noted OS with late leakage on angiography. Handling complex cases, cross specialty conditions. Certain conditions, such as optic neuritis, require knowledge from both neurology and ophthalmology domains. Um, as optic neuritis are ophthalmic and related ophthalmic finding related to a neurological disorder or case, which is the MS multiple sclerosis. Now, documentation essentials associated neurological symptoms such as vision loss or eye pain and MRI findings. Example, pain during eye movement, OS, vision loss, MRI shows demyelination near the optic nerve. Importance is in diagnosing MS and starting treatment early. Emergencies and acute scenarios, accurate documentation in urgent cases like strokes or retinal detachment ensures timely management. Case example, retinal detachment symptoms, sudden curtain-like shadow in peripheral vision, OD with flashes of light. Importance helps ophthalmologists decide on immediate surgical intervention versus monitoring. Multidisciplinary care, collaborative documentation, scribes often bridge multiple um, departments, ensuring seamless communication and record accuracy between specialties. Example of integration, stroke care with vision loss, as neurologists and ophthalmologists collaborate on imaging like CT scans and fundus exams. Example, CT confirms ischemic stroke in middle cerebral area, artery. Patient reports worsened vision OD. Diabetic retinopathy, coordination between endocrinologists and retinal specialists to ensure glycemic control and retinal therapy online. Example, HbA1c recorded at 9.8%. Patient scheduled for anti-VEGF VEGF injection OD. Role of the scribe, real-time charting, capture detailed provider conversations and examination findings without disrupting clinical flow. Accurate transcription, especially critical in describing complex diagnostic outputs like OCT or MRI. Compliant records maintain HIPAA standards in USA HIPAA and appropriate or proper content for medical coding, facilitating follow-ups, document timelines and history succinctly for smooth care transitions. Summary tables. Here we have table on neurological symptoms and documentation essentials. Um, Still same continuation for same table. Table of ophthalmic symptoms and required documentation. Continuing with the same table. Table on neurological diagnostic tools. Um, Table on ophthalmic diagnostic tools, table on multidisciplinary coordination in neurology and ophthalmology, same table continuing with it. And then next we will revise what we have covered through this lecture via some MCQs or multiple choice questions. Now, question one, which of the following symptoms should be prioritized in documentation for a patient presenting with suspected optic neuritis? A, sudden painless vision loss in both eyes without any pain during eye movements. B, retrobulbar pain worsened with eye movement and sudden central vision loss. C, gradual peripheral vision loss associated with mild photophobia in both eyes. Or D, flashes of light and curtain-like shadow over vision accompanied by floaters. Answer would be B, as optic neuritis commonly presents with retrobulbar pain that worsens during eye movement and central vision loss. Scribes should thoroughly document these details alongside any diagnostic findings, as this condition is often associated with multiple sclerosis, MS, or autoimmune disorders. Question 2. A neurologist a neurologist orders an MRI for a patient showing signs of multiple sclerosis, MS. What must the scribe include in the MRI documentation? A, the color contrast used during the scan. B, white matter lesion size, location, and enhancement with gadolinium contrast. C, patient complains of numbness and tingling prior to the scan. Or D, the time elapsed from symptom onset to ordering the MRI. The answer is B, white matter lesions characteristics, as the MRI findings, such as ventricular or spinal lesions that enhance with gadolinium contrast, are key diagnostic criteria for MS. Documenting these details is essential in tracking disease progression and confirming treatment strategies. Question 3. When documenting a patient suspected of acute angle closure glaucoma, which detail is least critical? A. Eye pressure, IOP measured during tonometry. B. Patients complained of severe eye pain, nausea, and vision blurring. C. Severity and specific location of redness in the affected eye. Or D. Cup to disc ratio findings during a fundoscopic exam. Although it's yet might be required, um, the least criteria here within the four choices still might be required to be documented by the scribe, but it is the least required, which is D in this case. While cup to disc ratio is important in chronic glaucoma, the immediate focus in acute angle closure glaucoma should be on symptoms, example, pain, nausea, blurred vision, and IOP changes to identify the need for urgent intervention. Question 4. A patient reports numbness in their right leg and difficulty walking over the past week. Which detail would be the most important to document for the neurologist? A. Sudden or gradual onset of weakness and progression timeline. B. The patient's history of wearing tight footwear. C. Results of past family medical history for diabetes. Or D. Color and texture changes observed in the lower limb skin. Answer is A. As the onset and progression of motor weakness provide essential context for diagnosing conditions like stroke, multiple sclerosis, or Guillain-Barré syndrome. This detail allows the neurologist to determine the urgency and potential underlying cause. Question 5. During fluorescein angiography for a patient with suspected diabetic retinopathy, which detail should the scribe note with the highest priority? A. Presence of microaneurysms, retinal hemorrhages, or bleedings, retinal bleedings, or neovascularization. B. The time of delay when the test was conducted, time of the day. Or C. The patient's correct visual acuity prior to the test. Or D. Patient complaints, floaters noted post imaging. The answer is A. As fluorescent angiography is a diagnostic imaging method used to detect vascular changes in diabetic retinopathy, documenting key abnormalities such as microaneurysms or neurovascularization is critical for staging the condition and planning appropriate interventions like laser therapy. And here we come to the end of this lecture. Thank you very much and goodbye.